Hello everybody. Today I'm going to little bit talk about flu or influenza. It is a viral infection and it's more common in winter months, and very easily spreads in the people who with sneezing, with coughing, and it is really high in winter. So I thought it would be a good thing to think about. So symptoms it's include fever, cough, sneezing, runny nose, headache, muscle ache, tiredness, sore throat. Now all children 2 to 13 years encouraged to have flu vaccine each winter. It not only reduces the risk of them getting unwell, but also reduces transmitting to family member. After the elderly, means over 75 years, children under 5 years have the greatest risk for admitting for flu, in the hospital. Now, I will be telling, like every day, that what is the red flag sign when you immediately have to go to the emergency department. So basically, if you see your child is mottled, means you know abnormally cold to touch, have blue lips, difficulty in breathing, unable to talk, drink, have a fit or seizure, extremely agitated, crying inconsolably despite distraction, confused, very lethargic, means difficult to have a rash that does not disappear on pressure, that if you put a glass, it will not fade up. So in that case, you have to go to the emergency department immediately. In NHS area, you can call 999. Now, second thing is about if this is not red flag, but still a bit worrying feature, like any of them, like it is called amber features, like is very hard, child is feeling hard to breathe, seems dehydrated, like sunken eyes, not passing urine for 12 hours, drowsy, irritable, unable to settle with toys, TV, food, picking up, if remains drowsy or irritable despite their fever comes down, extremely shivering, and complaint of muscle ache, has had chicken pox in last few days, now getting more unwell with high fever and rash, swelling of limb and joint, too painful for your child to stand, swollen eye, complaining of severe pain that is not improving with painkiller, 3 to 6 months of age of temperature 39 degrees centigrade or 102.2 degree Fahrenheit or above. But fever is common in children up to 2 days after the vaccination. Continues to have temperature more than 38 degree for 5 days. If it is getting worse or if you are worried, in that case you have to ring your GP surgery, call if you NHS area 111, or it persists for more than 4 hours and you think some of the red features developing, take your child to the emergency. So these are the things you have to keep in mind when you are taking care of your child with flu. Now, if those nerve features are none of them are there, then there is sore throat, there is cough, there may be diarrhea, vomiting, tummy ache, etc. can be there. So you can take care of your big child at home. But whenever you you can talk to your health visitor, pharmacist, 111, GP surgery, everything. So what you can do, basically you have to make your child comfortable, to lower the temperature with paracetamol plus minus ibuprofen. One, if you're use one, and if your child not improve to 3 hours, then try giving another medication. Um, Remember, this fever is a normal response to your body to fight infection. So it is just make them comfortable, not get rid of the infection with that paracetamol or ibuprofen. Avoid tepid sponging because it can reduce the temperature very quickly and it can cause fevering. Drinking is very important. Give as much, juice or fluid, sugary juice, etc. Cough medicine we not recommend, until 1 year, but age. But you can try if it is more than 1 year. If it shoots. Okay, so cough medication does not work. I already mentioned, but you can try more than one if it's that soothes. And good hand hygiene is very important. Usually it lasts for 3 to 5 days, but cough symptom can last up to 2 weeks. So with mild, rhino, sore throat, and slight cough, you may have question whether can go to the school or nursery. Otherwise, if it is well, you can go. But if it is unwell and very high temperature, it is better to keep them at home. Um, and of course, I mentioned whenever you are worried, you can contact any of that um, support system like health visitor, 111, pharmacy, GP surgery, or if you're thinking it's very serious, then you can go to the emergency. Hope this little talk helped, and we'll talk about another topics next session next week.